Well, good morning, Alex. Thank you so much for taking time out of your busy schedule to meet with me on today. I know it's Sunday and you're usually very busy, so I definitely appreciate you carving time out to talk with me a little bit about your profession. So, to begin with, can you share with us a little bit about how you were attracted to your world as a denturist and share a little bit about perhaps why you decided this particular profession?
Well, you're welcome. Thanks for coming and spending time with me. Well, I started, having an interest in this profession about 20 years ago when in 1999 I was working as an interpreter for immigrant population in Washington State. Doing so, I met a lot of denturists and dentists that were doing dentures, and that's how I kind of got acquainted with this profession. So basically, denturist is a clinical dental technician. So we're allowed to take impressions and fabricate denture from start to finish, and basically, get it adjusted. In some of the 6 states that allow denturists to practice, the scope of practice is, includes a little bit more than just making dentures. In some states, and Arizona included, you have to work kind of in conjunction with a dentist, which I do work with. Doctor, and we kind of refer patients back and forth, and he examines my work. We pretty much help each other and help our patients as well. So in '99, I got introduced to that profession, and in 2006, I got licensed after completing formal education in Washington State. And at that time, Arizona opened up the gates, so to say. So I came over as the first denturist of the new generation, because they had about 30 denturists that got licensed. I believe it was like 1980, and then for some reason they stopped licensing them, and I believe it was 2007 when they passed legislation here where the jurist was allowed to practice under dentist supervision.
All right, well, thank you so much for that. Sounds like you've been doing it for quite some time, so have a very large knowledge base as well as expertise. So thank you so much for that.
Dentist supervision.
All right, well, thank you so much for that. Sounds like you've been doing it for quite some time, so have a very as well as expertise for that. My next question is, I know that within the denturist market that there's a lot of growing that's taken place. Currently, a lot of your patients are consumer to direct, and I know sometimes you'll work closely with a referring practice. Tell us a little bit about how you're actually getting folks to come into your world, and with that, the larger percentage of patients you see, are they based on consumer to direct, or give us some understanding of how that lands in your office?
Well, I work directly with a doctor, general dentist, and he pretty much, and we also partner in one of the offices that we work out of. So we just do normal advertising for those patients, and when they come, there is a standard protocol of how we do things. Like they have an X-ray taken, doctor examines them, and then based on their need, if they have bad teeth, they are not interested in restoring them, they get the bad teeth pulled or all the teeth pulled, and based on the prescription, they get either partials or dentures. Most of the time, it's probably a denture case, because nowadays the dentistry is very expensive, and to restore, for example, one tooth which is questionable or is a goner pretty much in a couple of years, that investment is not wise to for the person to invest. So they just choose to have that tooth extracted instead of spending like 1,500, maybe 2,000 into restoring that particular tooth. And,
Yeah.
So yeah, most of the time, people who are interested or want to get information about dentures, it means that they already have some problems with their teeth, and they probably are looking into getting full mouth extracted dentures.
Okay. And that's a perfect segue to my next question. One would think that once individuals come into your lab here, that they're prepared to move forward and pay for that particular dental device. How often do you find individuals coming in that might have some reservations or either not real sure how they're going to be able to move forward and pay for that?
Well, a lot of times, the price of getting the teeth pulled and making dentures, or just simply just getting new set of dentures, is not affordable for the patient. So they have to come up with some different ways to finance this. And care credit is one of the options they have. Credit cards, maybe without interest, things like that. We sometimes try to work out with the patient a plan that would allow them to get that particular device or complete their treatment plan in a successful manner.
All right, very good. Thank you so much for sharing that. Now, the last question that I have for you, when it comes to the affordability of care credit, and you've seen the success of how patients have been able to use it to maybe move on and move forward, how do you feel that it has helped most patients, and how has it helped your particular office here?
Well, it sure helps patients because, a lot of times they already procrastinate because lack of finances, or, they don't have enough on their savings account, and they wait until really that situation where they have an abscess or pain, and they come in, it's like an emergency type of situation where they just have to, deal with the issue right away. So that's when, and unfortunately a lot of people are procrastinators, like those particular group of people. So, and the other option is for them to, like I said, maybe use some kind of credit card without an interest, or things like that. But it's hard to come up with a couple of $1,000s right away for any type of not necessarily dental issues, but medical issues as well.